Our next session is in partnership with our industry sector partner, MSD. A big round of applause for MSD, a great supporter. I'll skip the introduction so as we give the floor directly to our knowledgeable speaker. For that, join me in welcoming our moderator, Mr. Robert Mikhail, Vice Chair of AmCham Dubai. Welcome, sir. On the panel, we have Mr. Ashraf Malak, AVP Managing Director of GCC MSD. MSD again. Mr. Mohammed Mustafa, VP and GM of Saudi, Egypt, Libya, Sudan, IQVA IA. Welcome. And our First Lady in the panel, Mrs. Samia Sharif, Head of Government Affairs, Emerging Markets, Illumina. Last but not least, Mr. Rami At-Tayyar, Children's Hospital. Welcome.
Thank you.
Mr. Mikhail, the floor is yours.
Thank you. Please. Oh. Perfect. Thank you very much, obviously, to our esteemed panel for joining us today. We've had a continuing theme with our healthcare events in AmCham Dubai, right? So we've been speaking about things like sustainability of best practice post-COVID-19, the thoughtful deployment of technology to help transform the patient care experience. And most recently, earlier this year at Arab Health, we spoke about the current and future impact of AI on healthcare. So today's conversation is going to focus on a bit more of a deep-seated issue that those of us within healthcare have been trying to address likely for a while now, and can potentially be exacerbated by some of the advancements we're seeing in healthcare and the provision of healthcare. So we're going to talk about health equity or inequity, right, across parts of the developing world. And I think for me and for a lot of us in the industry, health equity isn't merely just a nice to have or a nice idea. It's essentially a fundamental right and principle that in every individual, regardless of their background, socioeconomic status, race, ethnicity, gender, geographic location, deserves the opportunity to be able to attain sort of the highest level of health. Right? But as we gather here today, we're all aware that health equity remains a bit of an elusive goal. Inequities persist and they exist. COVID-19 really showed us what the impact of these inequities are, disproportionately impacting marginalized and vulnerable populations, and really underscoring the need for some urgent action. So we've got an expert panel with us today. So without further ado, let me just dive right into it and kick off what's poised to be a hopefully deeply informative conversation. And as with the rest of the panels, right, we'll have an opportunity at the end to take a few questions. So I wanted to first start with you, Samia, and we can get right into it, right? I mean, when we talk about genomic technologies and advancing sort of next generation sequencing, we're delving into an area that can unintentionally create gaps in equity, just by nature of what we're trying to do. Can you share any examples of how Illumina is working with some of the developed markets to proactively address and mitigate some of this risk?
Absolutely, great question. Illumina, we are a global leader in genomics, and we realize that there is a big barrier, a big problem. There is a lack of diversity in genetic data. Today, about 87% of the data is from individuals of European ancestry. We can change this, and we have to change this to allow access to genomics worldwide. So in that context, we believe that collaborating with cross-functionally with different companies, different stakeholders, we launched together with Nashville Biosciences in the United States, in 2022, we launched the Alliance for Genomic Discovery. And we announced as well the joining of 5 founding members. So namely, we had 5 joining members from the pharma industry, Amgen, AstraZeneca, AbbVie, Bayer, and Merck. And the goal is to offer the whole genome sequencing of 250,000 samples, where there will be minor groups that will be represented, which was not available in genomic studies. And this is a big step towards getting access and having more diversity in the data. And in addition to that, we also launched a program, which is the Global Health Access Initiative. And this is a program that we worked closely with different stakeholders. We got guidance from clients, from funders, from market facilitators such as FIND. And the program aims at having a reduced pricing for low-income countries, reduced pricing for Illumina products, eligible Illumina products, to qualified global health entities that are funding this kind of initiatives. And this is really important to enable access, throughout everywhere in the world. And this will expedite access to precision medicine to everyone.
Thank you for that. I just wanted to follow up on one point. I know we spoke about this earlier. I know you guys are driving really towards democratizing sequencing and really making it more sort of in the hands of the people, right? And if we look at the advancement in the cost of sequencing and the improvement in cost, right? It cost millions and now it costs a few hundreds. Can you maybe talk about a specific case where Illumina's proactivity really helped maybe integrate some sort of sequencing that resulted in a tangible public health or just a tangible health outcome in a country in our region?
Absolutely. We could say that since Illumina participated and helped many governments launch their population genomics programs, which are large genomics programs. For example, we had the UK Genome Project, which started with 100,000 samples, and it became now our Future Health program, which is the largest program ever, which will have DNA samples from up to 5 individuals, volunteers that are volunteers to this program, which the main goal is to really work on the prevention and treatment of this disease, of various diseases such as cancer, such as other rare diseases and genetic diseases and neurodegenerative diseases, etc. And since then, a lot of countries and a lot of governments looked at having also in-country sequencing capabilities. And we can look at, for example, Egypt, where our technology for the Egyptian Genome Project is used. And this empowers the Egyptians to keep their samples at home and to be able to work on preventing diseases. This opens opportunities to pharma companies for drug discovery, for therapeutics development, etc. And in the region, of course, if we look at wealthier countries and wealthier economies, our technologies are also used in Saudi for the Saudi Genome Project, in Qatar for the Qatar Genome Project, etc. So this hopefully will lead to have more diversity in genetic data and will lead to other opportunities. And I think that a whole new world can begin from that.
So personalized and precision medicine will be a reality, not just the dream, right?
Absolutely. And we think that everybody deserves that. And together, we will be able to make this happen by overcoming barriers, by working together, by working closely with government leaders, by working on policy reforms, by enabling and empowering low-income countries to have this kind of technology at home so that they don't have to deal with sending samples abroad, which can be costly, and they can save time and money and energy. And we have a whole range of possibilities in making this happen all together.
Perfect. Thank you so much.
Welcome.
Hamad, we'll move to you now. So, I mean, those of us in pharma know IQVIA very well and know the value add, but most people have a problem even pronouncing the name, right, of the company, and they're a bit surprised. And can you maybe share, just for the broader audience, exactly or an example of where IQVIA has supported or spearheaded the introduction of a PPP or some sort of initiative to help advance equity in the markets you're responsible for?
Thank you, Robert. First of all, thank you very much for giving us the opportunity to be part of this important panel. And health equity is a global challenge, not only a regional challenge. However, of course, in our region, it's one of the initiatives which we start seeing. IQVIA as one of the leader companies in healthcare services, digital and data support to life science and government clients. We have been partnering with different stakeholders, which includes government, includes life science clients, pharmaceutical clients, as Robert mentioned. And over the last, I would say, 5 or 6 years, we have started to see a sort of a collaboration between the private sector and the government sector in some of the initiatives, basically because there is a CSR responsibility for the pharmaceutical companies, and at the same time, government is very keen to initiate some of the initiatives and is also looking for partnering with the private sector. On top of my mind, there are 2 examples, if you allow me. One from Egypt, where we worked with one of the leading multinational pharmaceutical companies and one of the authorities in Egypt, where we launched a solution to digitize on a national level the controlled medicines. For those of you who don't know, the controlled medicine is narcotic products where there is a challenge in terms of use or abuse or I would say challenge in terms of controlling the prescriptions. And of course, in a country like Egypt, it's a huge 110 million population. You would need a digital system who could link between pharmacies, between physicians, between government in order to ensure the part of the health equity, which is the access of medicine to the right people. And this is where IQVIA played a role in terms of supporting some building this digital platform. And this project was supported by one of the pharmaceutical companies. And now it's extending beyond the narcotics to the rest of the region. The other part, which apart from the digital we start to see, I'll give it from Saudi Arabia, which is more building capabilities. One of the leading pharmaceutical companies working with the government in terms of building clinical research associate. It's a position which was not available before, building the local capabilities in terms of helping, giving a certification to the newly graduated pharmacists or physicians to be working in the clinical research. And clinical research and clinical trials, as you all know, is one of the health equity initiatives because it allows access of medicine to the patient, even in specialty medicine or rare disease, where the diagnosis is the main problem. So we helped in providing the content, because we have a part of a clinical trial division, global clinical trials. So we helped in providing support to the government in terms of educating and training in a certified course for 6 months, and it was funded by one of the pharmaceutical companies. There are many, many examples, of course, in UAE, of a lot of examples as well. But of course, for the time, just I'm talking about those 2.
No, thank you so much. I wanted to follow up on something that we spoke about, obviously, the other day in preparation for this conversation, when you raised some of the work that IQVIA was doing in support of universal healthcare. And I think for many of us, I mean, universal healthcare is sort of this ultimate goal of really ensuring equity. But the road to get there is very long and difficult and troublesome, and it's plagued with all sorts of hurdles. I mean, what role do you think an organization like IQVIA can play to help maybe government stakeholders sort of understand, from a data perspective, from whatever perspective, how best to traverse this path to universal coverage?
Thank you. It's a very good question because universal health coverage is one of the main health equity achievement process. And we at IQVIA are proud to be part of digitizing the insurance in 5 or 6 countries in the Middle East over the last 4 or 5 years, and providing universal health coverage. And we have seen the journey with most of the governments in terms of the role of the government is to ensure the equal health opportunity for each citizen so that it provides the right treatment to the right people. The technology usually leads to data generation, and this is where it helps the government to take the decision. It helps them to understand where are the gaps, and it also helps them to track the insurance of the health equity, which is the access of the patient to different stakeholders.
Thank you so much. Thank you. Ashraf, we'll move to you now. And obviously, Big Pharma has a special place in both of our hearts. How do you envision the role of Big Pharma in being able to contribute to driving and achieving equity in the region, particularly in terms of some of these communities maybe that are a bit more marginalized and don't have access to the basic essential medicine and treatment?
Sure. First, thanks for having me. We know that health equity is an increasingly important subject, and it's finding its place on the global health agenda. If you've been to the COP28 this year, it's the first time where you see that there is one full day dedicated for health equity, where we had the WHO and other organizations. And the objective was to get different stakeholders together, to work together, to address this big issue, which is health equity. And here, where MSD finds that we're obliged, definitely, as part of our commitment to save and improve lives, to work with the different stakeholders to find a solution for that. Since then, we had 10% of our scorecard is how much we contribute to the health equity globally. And we contribute in different areas. So the biggest area, I think, which is very obvious, is clinical care. So we work very hard to make sure that we'll bring the right medication, the right vaccination to the global population where we see the biggest gaps there. And once we have it there, the next step is how we make sure we will accelerate access of those innovation to the population. For example, countries like UAE, countries like Saudi, like Middle East, that like 10, 15 years ago, to get a new medication here, it used to take like 3-4 years to have it after the FDA approval or the EMA approval, European approval. Now you get the medication as soon as it's approved in the US or approved in Europe. Sometimes you get the medication here before big countries like Germany and France. So this is how we're trying to accelerate to the communities where in the past used to be a Middle East, like third world countries. Another thing is medical education. I think that medical education is as important as clinical care. I believe that it's even bigger than that. WHO shared these statistics that 60% of population with low education, they believe that they have a good health. Whereas 90% of population with high education, they have a good health. You see the gaps, 30%. This is really huge. You want to think of that before you start to think of a clinical care. I was in Africa 2 years ago. I went to one of the places like Food Street, and there was a guy, very gentleman, very nice guy. He's selling some local products, and he had 2 cups on the table. One for tips, and the other one was save my mother life. And he was really smoking heavily. I said that, what's wrong with your mother? He said that she has lung cancer. Say that, yeah, then you have really to take care and stop smoking. He said that, why is that? My mother has a lung cancer and she was not smoking. Then I was explaining to him that what genetic factors mean, what risk factor mean, and say that you have genetic factor because your mother has lung cancer. You're adding to this a risk factor because of smoking. He was really listening, right? He was absorbing, listening, and he kept asking questions. 2-3 days after that, before I really wanted to travel, I wanted to see him again, right? So I went there, He was still smoking, but not as heavy as he was using 3 days. So he said, like, yeah, how are you? Since you talked to me, I'm trying really to cut on smoking, and I'm telling this to everyone in my community. This is exactly medical education, right? This is how you can empower people to take decisions to control their lives. So, and there's more and more areas where we believe that we can work with the different stakeholders to contribute to the health equity globally. Yeah.
Wonderful story. I wanted to follow up on the comment you made, Ashraf, about obviously working together. I don't think no one person or company can do this alone. So what role do you think, collaboration between pharma, governments, NGOs, all of these stakeholders are going to play in really trying to promote equity and just to improve access in general across our markets?
Yeah. I think the name of the game here is public-private partnership. Definitely, the government by itself cannot really find the solution. Private market cannot find the solution by themselves. It has to be all of those working together. This year, for example, like in COP28, Bill Gates was here, right? And he announced in collaboration with MSD program and other contributors, program of $770 million to fight tropical diseases across the globe. $500 million out of this was specifically dedicated for a disease called river blindness, and mainly for people in Africa and people in Yemen, to make sure that we will eliminate that. And that was by donating the Mictizan, which is a product for antiparasitic product that is produced by MSD, but you want to work with the different partners to make sure that you can deliver that. One important thing that we keep looking at, exactly what you said, that the underrepresented communities, right? So, for example, that one of the most vulnerable communities are women who get pregnant to deliver babies, especially in many areas across the world. We developed a program with 400 individuals and organizations to put together what's so-called Merck for Mothers, to make sure that we want to reduce the death or fertility rate within the pregnant woman and enhance their health standards and well-being. Over the last 12 years, we managed to improve the lives of 13 million women who went through pregnancy, delivering babies, and postpartum on 48 global sites across the world. The dearest one to my heart is what we're doing here in UAE. So, that the cancer treatment is really getting more and more expensive, right? The technology, the innovation to get a new cancer treatment is not really cheap. And we acknowledge that there is communities, especially the low income, less privileged, that cannot really make it, and they're not really insured. So in UAE, a couple of years ago, we launched a program with Ministry of Health, across with different NGOs, to develop what's so-called the OWN program, OWN, which means help or support in Arabic, where we contribute, NGOs contribute, sometimes the government contribute for the patients who cannot really afford cancer treatment. So those are small examples, but I think that moving forward, we want to keep looking into those less privileged communities. Yeah.
Thank you so much, Ashraf. Moving to you, Rami, it's good to have you with us. I know you struggled a little bit coming from Abu Dhabi.
That's quite all right.
And we appreciate your presence here and also sharing now the voice from a provider perspective, right? So in what ways do you think, and I know you're at the Children's Hospital, maybe the equity conversation takes a different form, but if you could speak in general,
Sure.
In what ways do you think healthcare providers or folks who provision healthcare services can advocate for either policy change or some sort of systemic reform to promote equity across sort of social determinants of health?
Well, thank you, Robert. Before I begin, I want to take this opportunity to really acknowledge AmCham and all the great work you guys do in bringing American businesses together and unifying our approach and aligning us with the UAE vision and the government's vision. I've been privileged to be a member of AmCham for almost 15 years now, and the work you guys do is unmatched. So congratulations on all your success, and thank you for providing me the opportunity to be here today. To answer your questions, I think as providers, we could really foster and use our influence and expertise and relationships with policymakers and communities. Ashraf made an excellent point about education, and I think that regardless of your target audience, education turns them audience into advocators for themselves and advocators for whatever vision that you're trying to get across. And at the same time, doing research and data collection to provide that information to policymakers. So I think by combining those two, you get to achieve that.
Perfect. And if we can follow up, okay, I mean, patient education, health literacy, I think we're aligned on the importance, but I want to specifically ask you in terms of, are you seeing instances where, cultural competence, humility, some sort of local sensitivity to the culture can help reduce disparity in treatment?
Absolutely, and I smile because this is close to home, and thank you for asking that question. So I'm going to ask you a rhetorical question. Do you believe that a patient's state of mind affects the success rate of his or her treatment?
Sure.
Right, so with that sensitivity and bringing that humility and understanding and fostering a deep understanding of the patient's backgrounds, you get to terminate any external stress and making that patient focus on their treatment. I work as the regional director for Children's National Hospital, so I look after patients that travel from the GCC region. Through a department at our hospital in Washington that's called the Global Services Department, we have something called the PFAC, Patient and Families Advisory Council. We really listen to patients that come from different backgrounds and ethnicities and different beliefs. And prime example, our GCC patients are mostly Muslim, and they get to the point where they're actually speaking to our chefs in the kitchen, and we did in fact change our menus to make most of our meals halal. Times in Ramadan, breaking their fast at the appropriate time, providing space for them to pray, parking spots, providing them with badges that they don't have to wait in lines and be able to go around the hospital at ease. Again, you guys made an excellent point about certain diseases and how long it takes for these diseases for treatment. So if we're looking at the likes of bone marrow transplant or heart transplant, those patients are spending a year at your hospital. You have to understand that every family comes with different backgrounds and different beliefs, and you're trying to make it as easy as possible and make them feel that there's nothing outside of their treatment that they should be focusing on or stressed about, just their treatment. And going into that treatment at ease makes a huge difference. So.
Perfect. So do you feel, and it's great to hear that you're, at least you guys are focused on it. I hope it was the case across the board, right? Which it unfortunately is not. Do you feel that there's a way where providers can sort of proactively work to address some of these sort of more implicit biases in the way they deliver healthcare?
Absolutely. We have a very strong commitment to the DEI, and that is spearheaded obviously by our Chief Diversity Officer. We have a very diverse workforce, and we do employ a lot of healthcare workers healthcare community workers that work and live in their communities, coming from different backgrounds, promoting diversity and making sure that there's a deep understanding through some bias awareness policies that we implement, and strategies that we have and guidelines that we have in place. And at the same time, we do constant evaluation and providing feedback. So across the board, like to answer your initial question, across the board that happens. So I think that by time, again, if there's improvement, there's always improvement, and it gets better and better by time. But definitely there's more. There's a better understanding today.
No, it's impressive and refreshing to hear. Thank you. Thank you for sharing. So I am cognizant of time, and I want to leave a little bit of time for folks in the room to ask questions. So I'll ask maybe one or two quick questions to all of you. We could start obviously here with you, Mohammed, and move across. Just very, very briefly, what do you feel, maybe looking ahead in the next 5 years, are maybe one or two of the most pressing either priorities or opportunities for action that we can work for, that you'd like to share, that we should work for to addressing inequity?
Yeah,
Thank you. I think healthcare awareness, digitization, change management, it's very important component, and fair education, healthcare education.
Very good.
Thank you.
Thank you. Simon?
I think that from a global perspective, if we improve the access to genomics and access to healthcare by having more diversity in the data will be a huge achievement. And this is something that we are working together with other pharma companies and NGOs. And I think a lot of work can be done there through, like Ashraf said, private-public partnerships. This is key to success because we all have to work together towards that, and we can bridge the gaps and then see what we can improve depending on regions, because every region, every country have different health priorities.
Yeah, so first, we really want to picture the reality first, right? So the reality is as following, that we are all aware of. Number of population globally increasing, right? Prevalence of diseases increases. The inflation increases. More countries have their currency devaluated versus the dollar and the euro, where you get the innovation from. So even there is more and more pressure on those countries to get this innovation to their countries and provide solutions to their people, right? Low income population is increasing. Wars increasing. So if you look at this,
I want you to make us happy, not make us depressed.
no, to be happy, you really want to see really how we really can fight this. So this is the reality, right?
Yeah.
But on the other hand, what can really make us happy here is that the technology is really great area where you really can now spread, healthcare education with disparities, with eliminating any barriers, because you can reach anyone with the social media, with online education, right? If you look at now what we've seen yesterday with Microsoft, signing an agreement on AI and data management in the healthcare, where it can help people to start to proactively work on the problem before it really goes big. This is one thing. The other really important thing is, after the COVID, the government start now to realize that it's all about prevention. It's important to prevent before you start to treat the problem. And here where we can see that there is more and more interest in the vaccination, in the vaccine, and that will really save a lot of headache for the future. So between vaccination, unlock the potential of data, medical education through the technology, I think those are the opportunities will really help this bigger problem to become smaller.
Thank you, Ashraf.
I think you guys covered it all, right? Digitalization and ease access to information. I think that provides patients with the information they need, the support system they need, right? For prevention, like you said, and for disease management, so forth and so on. And then by education, turning them into advocates. So I think combined everything that you said is most probably would be the ideal solution.
Excellent. So we got a couple of minutes if there's any questions from the room. Siobhan.
Okay, so for the folks on the panel, 2 questions. First, I'd like you to speak a little bit about the role of health equity in innovation. So looking at the populations that have traditionally been underserved, not only as folks who need support, but also as sources for ideas and inspiration for innovation across healthcare provision. And then the second question that I have is, so of course the infrastructure to deal with the climate transition is a little bit different in the UAE compared to parts of the United States. And so I'd like to ask sort of how the climate transition is sort of informing where you see opportunities for investment and sort of changes that are necessary. I'm thinking particularly given the heavier rains that we experienced in the past couple of days, whether or not that's sort of inspiring thoughts around waterborne illness treatment, or how do you manage sort of like the changes in likely healthcare issues across different populations? If you can speak to that would be great. Thank you.
Yes. Who wants to kick us off?
I can start. So I'll start from the second question. I was born and raised here. A lot of times people forget that the UAE is 50-some years old, right? But by the leadership of the UAE, the locals and those that live in the United Arab Emirates got used to being the best at everything. And so they always want to achieve number one, right? In healthcare specifically, there are gaps. Being a young country, you do make mistakes trying to fill those gaps. But in time, you get to learn from them. So we've seen in Abu Dhabi Cleveland Clinic come about, but prior to that, there was about 10, 15 years era where you were trying to fill in that gaps for adults that are traveling constantly outside of the United Arab Emirates for care. That has been achieved, and then those gaps has been by time filled. Now we are seeing this, and I'm Children's National Hospital, so pediatrics. So we're looking at, and I'm more focused on peds, on children, and we see that also being filled by doing different programs. We realize now, or the United Arab Emirates realize now, that I cannot just have to build a beautiful building and have a perfect brand outside, and that's that. You have to be able to do long term, and by long term, you're bringing physicians and you're bringing specialty expertise from abroad to do training. Research and education is part of it. Research is a big portion of what the United Arab Emirates is focusing on now. And we've seen delegations travel to the United States last year and the year before, and signing MOUs with big research organizations to really fill in that gap. So bit by bit, those are being filled. And things that happen, like the rain that we just experienced, again, I look at those as opportunities for us to learn and move forward and fill in those gaps, regardless of the industry. Does that answer your question? And the first question was? Yeah, I think. I think you.
So I think you raised a very important point, and looking at what happened lately with the pandemic and how we emerged out of that, this accelerated access to genomics and accelerated the need for genomics to track variants. Actually, speaking about vaccination, for example, during COVID, when coronavirus emerged, nobody had an idea about this virus, and Illumina sequencers were used to sequence the virus. And from that, the genomic data has been used by Pfizer, by Moderna, and by AstraZeneca. They were able to use that genomic data to work on a vaccination that we all used. Looking at that, I think that this increases a number of opportunities for everyone, for the whole ecosystem, for healthcare companies, and we can all work together to be better prepared, knowing that a lot of governments opted for pandemic surveillance, and this enabled them to track the variants and to understand the mutation of certain variants and how things can change. And I think that we live in a world that is very challenging, adding to the fact that there is a climate challenges everywhere. I mean, we have seen what happened in the UAE. We have seen that some areas become, there is an exceeding heat. There is also a faster spread of certain diseases under certain temperatures. And this is where the adoption of new technologies, next generation sequencing technologies is really important to understand how certain diseases spread faster than others, and how we can all together look at opportunities in drug discovery and use the data to better understand and to better plan, and to also allow our colleagues in the pharma industry to work together and to find treatments and to increase opportunities in drug discovery, but also in the education. I think with the pandemic, we learned the lesson, and we should really be prepared for the next one, and hopefully we'll face it much better than, we learned from experience. So I think this will open a whole new world for all of us to better manage. Does that answer your question?
Hi.
Madam Nisar. Please.
Sorry. My name is Nibal Dahaba. I come from a pharma background, leading a couple of multinationals. And now I believe I'm representing a project which is a great example for health equity. I'm a co-founder and shareholder of GemVax, which is the first vaccine facility full production cycle in the region. We've just been granted the golden license from His Excellency President of Egypt. GemVax will be catering Africa as an African hub based from Egypt, with covering 20 kind of vaccines, which covers the NIP or the National Immunization Programs all across the emerging markets, with full tech transfer rights upstream and downstream. Also, we'll be having a regional hub for R&D with the first strain bank in Africa, first accredited animal house, and a BSL-3 lab. So the question is, how would the multinationals or the US companies provide us with help in the term of innovation and drug discovery? How would genetics and genome help in the R&D? And is there a real will to do the tech transfer and give it to the emerging markets? So basically the question is for Dr. Ashraf and yourself.
Sure.
Thank you.
No, I think that to second part of the question or first part about tech transfer, it was a taboo to definitely transfer any technology from the US or Europe, specifically from US, to the rest of the world. That was really clear taboo that you really cannot touch. We see that with time, with the concept of health equity after the COVID pandemic, there is more and more understanding that how you can really want to find solutions for the rest of the world. For example, when MSD came up with the first antifungal for COVID treatment, what we did that, we said that we will go to the countries across the world where they are considered low income with high population, and we're going to give up in our IP. And we'll give them voluntarily licensing, and you can, just manufacture the product, take the technology and do it in your own country, and they will do it for free. It's like Vietnam, Indonesia, Egypt, by the way, Brazil, Mexico. We give them the IP for free, and you can really do it. So this is one of health equity commitment. In addition to that, we can see that there is more and more tech transfer coming to the region. So we're discussing definitely with different governments in Saudi Arabia, in UAE, in other parts of the world, how we can host the technology in these countries. The challenges are very well known because capabilities are not 100% available here. To transfer the technology of vaccine, this is really something really big. So what we're trying to do is we're doing the stress test. We see where are the gaps here. And the biggest gap is building the right capabilities, the right people who can really host this technology within the countries. And this is a long-term program that we're trying to transfer to those countries in the Middle East. Yeah. For genomes, I think.
Oh, sorry. Yes. So I think you raised a very important point, and this is something that His Excellency, the President of President El-Sisi, attaches a high importance to that, and that's why the Egyptian Genome Project was launched 2 years ago, almost 3 years ago. So the Egyptian Genome Project aims at having a cohort of different variety of samples from across Egypt, from the different governorates, and basically it will allow Egypt to understand the genetic mapping, but also understand the prevalence of certain diseases over other diseases. And the target is really to focus on key diseases that are affecting the Egyptian population, so some rare diseases, some genetic diseases, and so on. And I think with that, Egypt is really looking at becoming a leader in the field, and we are doing everything to empower them, not only through trainings, but also we hosted, for example, last year a Genome Conference Day, where basically we had different government officials and different KOLs. We had a scientific discussion. We covered different areas, the different health priorities. Our technology is also used by the Egyptian CDC, which was launched a few months ago. And this marks a really a new era for healthcare and a new development and an acceleration to precision medicine, which is a high priority in Egypt. So I think together with the fact that a lot of work is also being done by the pharma industry, this will enable, and this is enabling Egypt to become a leader in the continent and to also be able to collaborate with neighboring countries maybe and exchange more knowledge and there is also room for more capacity building. This is a topic also that we are discussing with the Ministry of Higher Education. If we look at academia, where sequencing technologies are used by leading universities in Egypt. So everything is really done in the way of empowering the country to have everything at home, to have the knowledge, to have the technology, and also to understand how to use the data so that they can benefit from it and they can improve human life and also allow Egyptians to live healthier and for a longer time.
Thank you for the question. I think we have time just for one more. We'll hand
My
it to
question is a
Mohammed.
bit lengthy, so I ask it, and I'm happy to hear the answer offline. Building on Ashraf's notes about the high inflation, high population, lower purchase power. So there is a trend that we see in the low-income countries as we speak. And my question is to Mohammed and Ashraf both together around counterfeited medicine, right? And we see an increase in counterfeit activities, unfortunately, when it comes to medications. Are we tracking this somehow to help the governments to track down these medicine in IQVIA, and how the big pharma companies are trying to play a role to avoid counterfeiting the products? I know it's a lengthy one. We can take it offline or if we have time. Because Mehdi is standing.
Yeah.
No.
No, I think this is a very important question, right? So that doesn't really take one-part effort, right? So if you want to fight for counterfeit, definitely you need to work with the government who can enforce the law and with the policymakers in the countries. I was watching Randomly program on one of the Lebanese channels, by the way, and I saw this program that really got to me. So someone that he dedicated his life to help people with cancer because his mother died with cancer. What was he doing? Trying really to promote fundraising for cancer, trying to go to any people who had cancer and died. So look for their people, sons, daughters, to give them back anything that they still really keep for cancer medication, or even if they can really give money to help people who cannot really buy products for cancer. And he said that, imagine what is number one problem is not the money, because we got the money, but the problem that when we were buying the medication, it ended up that we're buying a counterfeit medication. So you get the money to buy a counterfeit medication. And he said that, and our biggest problem here is we don't have a law or clarity on how we can enforce to take discipline actions in this case. So it's really a growing problem. Countries like UAE, countries like the GCC countries, like on top notch of that. So really very clear, they say that they have a hotline that if you just have any doubt about counterfeit, just give us a call and give us the patch number and just leave it to us. We haven't faced any issues here. We have faced probably a couple on couple of countries in the GCC in the last 2 years, and it was solved in 7 to 10 days. But because of the government, we were able to do that. So I think, yeah, this is a growing problem, and there has to be a joint effort between private sector and the government, definitely. Yeah.
Just to add on what Ashraf has said, there is a national program which is called Track and Trace, which is implemented in different parts of the world and started to be implemented here in different countries, which is tracking the barcode of the medicine to be able to know the source of origin. And this is one of the things which we are talking about, of the use of digital to help in reducing some of the irregular behaviors.
Yeah. We signed an agreement with DOH in the GITEX on implementing blockchain in the vaccine. And once you have a blockchain, definitely this will be a bulletproof against counterfeit, but you cannot have this for every single medication because the technology is really expensive and complex as well. But this is one of the solutions, similar to the track and trace here.
Thank you very much to our wonderful panel. Thank you to everybody for your engagement. And I think with that, we'll conclude. Thank you.
Thank you, Robert. Thank you, esteemed panelists, for these great insights. Congratulations for all that has been done. Thank you. Thank you for each and every one of you. We will not be thanking enough our strategic industry partners, MSD, Cisco, Microsoft. Big round of applause for them for all their support. Thank you.